On March 23, 2010, President Barack Obama signed the Affordable Care Act into law. This was a landmark moment for the United States healthcare system because prior to this, uninsured rates were high. Before the Affordable Care Act, many people were excluded from health insurance coverage because of pre-existing condition discrimination and the inability to afford insurance. The Affordable Care Act expanded access to Medicaid for people with incomes 133% below the poverty line. The Affordable Care Act has helped expand men's health access to multiple preventive care services by eliminating cost sharing. These include reproductive health and sexually transmitted disease services, immunizations, cancer screenings, and mental health screenings. Despite the successes that the Affordable Care Act has in expanding Medicaid access, there are still disparities in the affordability of healthcare between minority populations. There are also some health amenities that are not covered for men under the Affordable Care Act. The Affordable Care Act has expanded healthcare access to many people in the United States. For insured middle-aged or older men, the Affordable Care Act requires most private healthcare insurance plans to cover preventative screenings for blood pressure, cholesterol, colon cancer, depression, HIV, and others without a copay or deductible. Expanding access to these services improves the health of older men because these conditions are some of the leading causes of death in men in the United States. Accessible healthcare is one of the major social determinants of health and should be prioritized to better the health of men. Men already do not utilize healthcare as much as they should, causing them to be at a higher risk of mortality for certain illnesses. Requiring health insurances to cover these expenses will help men gain access to these resources and hopefully help destigmatize men prioritizing their health. In states that have expanded Medicaid access, like California, studies have shown that giving men greater access to healthcare is positively associated with having a preventative care visit in the past year. While the Affordable Care Act has decreased uninsured rates and expanded access to healthcare, it sometimes fails to address health disparities that Black Americans face. Young Black men are disproportionately victims of violent injuries in the United States. Despite making up 2.4% of the population, they experience 26% of violent injury and 25% of homicide victims ages 18 to 29. Young, low-income Black men are far less likely to have health insurance when compared to white men. The Affordable Care Act created a new healthcare workforce called the Navigators and In-Person Assisters to support minority populations. All states have these navigators as required by the Affordable Care Act in order to help people understand and enroll in health coverage. A study was conducted at two of the largest and busiest trauma care facilities in Maryland about the effectiveness of navigators and in-person assisters. It concluded that these navigators and in-person assisters play a critical role in educating young, violently injured Black men about the Affordable Care Act. They found that some Black men were uninformed about the Affordable Care Act regulations and often thought they received free insurance. With the help of the navigators and in-person assisters, minority populations are provided with extra resources to address health disparities. Medicaid has been expanded in all states besides 10. The states that have not expanded Medicaid include Alabama, Florida, Georgia, Kansas, Mississippi, South Carolina, Tennessee, Texas, Wisconsin, and Wyoming. Because these states did not adopt Medicaid expansion, 1.5 million people fall in a coverage gap within these states. This coverage gap disproportionately impacts minorities, especially men. Of all the non-elderly adults in the coverage gap, 62% of them are minorities. States that have adopted Medicaid expansion have decreased the amount of uninsured people living in their state. Since men are more likely to be uninsured than women, Medicaid expansion is directly related to the topic of men's health. Men living in non-expansion states that have an income too high to qualify for the Affordable Care Act but also cannot afford their own insurance are not able to access important health screening or services. By expanding Medicaid, men of all races, but especially minority men, will have greater access to health insurance. Another health concern in men's health that has not been adequately addressed by the Affordable Care Act is prostate cancer screenings. Prostate cancer is one of the leading causes of death for men in the United States. Despite the Affordable Care Act being one of the most important healthcare legislations in the United States, there have been studies that display delayed treatment for prostate cancer even after its implementation. They have found that non-white men are more likely to experience treatment and diagnosis delays than white men. These findings were consistent from the years prior to the Affordable Care Act and after it was established. Men with Medicaid coverage and uninsured men had no difference in their delay times, but men with private insurance are significantly less likely to experience delays in their screenings. Interestingly, it has also been found that delays increased right after the Affordable Care Act was passed. This is thought to be because of the influx of people who had gained access to coverage for their screenings. While it is beneficial to have expanded the access to prostate cancer screenings, addressing the increased delays is a valid concern for men who are at risk of developing this disease. The Affordable Care Act has made great progressions in addressing health disparities and increasing access to healthcare, but prostate cancer remains one health concern that is still facing screening delays. This is a prominent issue in men's health that will severely impact how many men can actually receive proper treatment for prostate cancer. Expansions to the Affordable Care Act is a direct way that policies can improve the lives of minority men. Minority men are more likely to be uninsured and, as a response, do not receive the health care that they need. Without health insurance, minority men are more likely to get diagnosed and pass away from prostate cancer and heart disease. Expanding Medicaid coverage will help minority men live longer by allowing them to detect health problems early on. There is already stigma surrounding men's health, and even insured men delay their visits to the doctor because of it. High rates of uninsured minority men will continue to reinforce the stigma and harmful idea that men do not need to go to the doctor or utilize health services. Expansion states have seen reductions in racial health disparities when compared to non-expansion states. Racial health disparities are caused by many factors. These include lack of accessibility, medical mistrust, and systemic racism. Expanding access to healthcare will improve the lives of minority men because it will ensure that they have the same access to care as white men. The Affordable Care Act is one of the most important pieces of healthcare legislation in the United States. It allows millions of Americans to have access to healthcare who were previously uninsured because they could not afford private health insurance. Although it is a successful piece of legislation in most cases, minority men still face challenges to accessing coverage and preventative services. Delays in prostate cancer screenings were also not improved after the implementation of the Affordable Care Act. These are both critical men's health issues that the Men's Health Network prioritizes. We hope that you learned more about the Affordable Care Act and how it impacts men's health.